Welcome to the Brainetainment channel, where we feed your mind with enlightening and entertaining content. We're here to serve you a hearty blend of knowledge and amusement, fueling your curiosity and keeping you engaged. Today we're going to dissect a topic that's often mentioned but seldom understood in its entirety. We're going to explore the silent and subtle nuances of hypertension and hypertension. These conditions, while opposite in nature, are equally significant and often misunderstood. Hypertension, also known as high blood pressure, and hypertension, also referred to as low blood pressure, are conditions that silently creep into our lives, affecting millions worldwide. As we navigate through this topic, we'll uncover the science behind these conditions, compare their impacts, and shed light on their prevention and management. So, buckle up as we embark on this enlightening journey. Prepare to delve into the world of blood pressure and understand two conditions that silently affect millions. Before we dive in, it's crucial to understand what blood pressure is. Simply put, blood pressure refers to the force that your blood exerts against the walls of your blood vessels. Now imagine your heart as a powerful pump. Each time it beats, it propels blood through an intricate network of vessels, delivering vital oxygen and nutrients to your body's tissues. So how does the heart maintain this pressure? Well, it relies on two key components: the strength of its own contractions and the resistance offered by the blood vessels. When the heart contracts, it generates a high pressure to push the blood forward. This is known as a systolic pressure. On the other hand, when the heart relaxes, the blood vessels offer a certain resistance to keep the blood flowing, creating the diastolic pressure. With a clear understanding of blood pressure, we can now explore hypertension and hypotension. Hypertension, often known as the silent killer, is a medical condition that often goes unnoticed. It's a condition where the force of blood against the walls of your arteries is consistently too high, often leading to severe health complications. Now, why is it frequently termed as the silent killer? Well, it's primarily because it often lurks in your body without any obvious symptoms, patiently waiting to strike when you least expect it. It's a deceptive condition that can quietly damage your body for years before symptoms develop. But what causes hypertension? Let's delve into that. A variety of factors can contribute, but the three most common culprits are unhealthy lifestyle choices, genetic factors, and stress. Regular consumption of high-sodium foods, lack of physical activity, excessive alcohol or tobacco use, all these lifestyle choices can significantly increase your risk of developing hypertension. Genetics also play a role. If your parents or close blood relatives have high blood pressure, you're more likely to develop it. And then there's stress. Chronic unmanaged stress can lead to hypertension by causing your body to produce a surge of hormones, which can temporarily increase your blood pressure. But how do you know if you have hypertension? While it's true that hypertension often doesn't have visible symptoms, there are subtle signs to watch out for. These may include persistent headaches, shortness of breath, and nosebleeds. However, these symptoms typically don't occur until high blood pressure has reached a severe or life-threatening stage. And the damage it can do to your body is significant. Hypertension can lead to heart disease, the leading cause of death worldwide. It can also lead to stroke, kidney disease, and other serious health problems. In essence, hypertension is not just a silent killer, it's a silent destroyer, gradually wearing down your health over time. It's a condition that requires our attention, vigilance, and most importantly, proactive management. Hypertension, if not treated, can lead to severe health complications. On the other end of the spectrum, we have hypertension, an often underestimated condition. Hypertension, or low blood pressure, is a condition that doesn't get as much attention as its notorious counterpart, hypertension. Yet it's a health concern that deserves our attention. But what causes hypertension? Several factors can contribute to it. Dehydration, for instance, is a common cause. When we're dehydrated, our body loses more water than it takes in. This can lead to decreased blood volume, thus causing a decline in blood pressure. Heart conditions can also cause hypertension. Conditions like heart failure, heart attack, or changes in heart rhythm can prevent the heart from pumping enough blood, leading to low blood pressure. Certain medications, including diuretics, beta blockers, and certain types of antidepressants, can also cause hypertension. The symptoms of hypertension can be subtle or quite obvious, depending on the severity of the condition. One might experience dizziness or lightheadedness, especially when standing up too quickly. This is due to a sudden drop in blood pressure, a condition known as orthostatic hypertension. Fainting spells and blurred vision are also common symptoms. Some people with hypertension may feel nauseated or have a lack of concentration. But why should we worry about hypertension? Isn't low blood pressure better than high blood pressure? Well, not always. Hypertension means that there's not enough blood flowing to your organs, including the brain and the heart. This inadequate blood flow can cause organs to malfunction or even fail. For instance, if hypertension deprives the brain of sufficient blood flow, it can lead to a fainting spell or a stroke. If the heart doesn't receive enough blood, it can lead to a life-threatening condition known as shock. So, while hypertension might not make the headlines as often as hypertension, it's a condition that can have serious health implications. It's a reminder that balance is key when it comes to our health. We need our blood pressure to be just right, not too high and not too low. Hypertension, though less talked about, can also have serious implications if left unattended. So let's give it the attention it deserves. And remember, your health is in your hands. While these conditions might seem daunting, there are ways to prevent and manage them. The first line of defense against both hypertension and hypertension is a lifestyle change. This includes regular physical activity, limiting alcohol consumption, and quitting smoking. Exercise, for instance, helps regulate blood pressure by making your heart stronger and more efficient at pumping blood. Diet also plays a crucial role in managing these conditions. For those dealing with hypertension, a low-sodium diet is often recommended. Consuming too much salt can cause your body to retain water, which can increase blood pressure. Similarly, for hypertension, it's suggested to increase your intake of salt and water, albeit in moderation. It's not just about what you consume, but also how you consume it. Regular, balanced meals can help prevent blood pressure from dropping too low. On the other hand, overeating can lead to obesity, a significant risk factor for hypertension. Medical interventions are another critical aspect of managing these conditions. For hypertension, medication may be required to lower blood pressure. These medications can range from diuretics, which help your kidneys eliminate sodium and water from your body, to beta blockers, which make your heart beat slower and with less force. In the case of hypertension, treatment may not always be necessary. However, when it is, it can involve medications to increase blood pressure or underlying conditions causing the low pressure may need to be addressed. But remember, every person's body responds differently to lifestyle changes and medication. It's essential to work closely with your healthcare provider to find the best approach for you. Regular checkups and monitoring your blood pressure at home can also help keep these silent killers at bay. Lastly, stress management is crucial. Chronic stress can contribute to hypertension, and learning to manage it through techniques like meditation, deep breathing, or yoga can make a substantial difference. Awareness and proactive management are our best defense against these silent threats. As we reach the end of our insightful journey, let's summarize what we've learned. We've delved into the complexities of blood pressure, a vital component of our health that often goes unnoticed until it becomes a problem. We've explored hypertension, the silent killer, a condition characterized by consistently high blood pressure. It's a stealthy condition, often showing no symptoms until it's too late, leading to severe heart and kidney conditions, strokes, and even death. We've learned that it can be caused by numerous factors such as genetics, stress, an unhealthy diet, lack of physical activity, and excessive alcohol or tobacco use. On the other side of the spectrum, we've also touched on hypertension, an often underestimated condition. This condition, marked by consistently low blood pressure, can lead to dizziness, fainting, and in severe cases, shock. We've discovered that causes of hypertension can range from dehydration and blood loss to certain medications and underlying health issues, but it's not all doom and gloom. We've also discussed several preventive measures and management strategies for both conditions. Regular exercise, a healthy diet, limiting alcohol and tobacco use, and regular checkups can help manage hypertension. For hypertension, increasing salt and water intake, wearing compression stockings, and careful medication management can be beneficial. The key takeaway from our journey today is that awareness is crucial. Understanding these conditions, their causes, symptoms, and effects can help us take the necessary steps towards prevention. It's important to remember that our health is not something to be taken lightly or ignored until it's too late. Remember, knowledge is power, and your health is in your hands. Thank you for joining us on Braintainment. If you found this video helpful, don't forget to subscribe for more enlightening content.